Hi guys! We are going to be talking to you about the eyes. That's our main focus, because I feel that when I walk up to somebody, the first thing that I look at is mainly, I'm all about having eye contact when you're having that conversation. Biggest thing is, you don't have to squint, it's okay, is with Botoxing or Dysport or using zoom in for these crow's feet here. But then also one thing that we miss is when we're paralyzing this muscle, putting it to sleep for about 4 to 6 months, here we forget to get these bunny lines here. So go ahead and smile. So you see that he gets these little fine lines over here. So it's good with Botoxing both areas. There's some patients that will need, they have a little bit of an indentation here in the tear trough, or sometimes it will go all the way down to the malar fat pad. So what I'll do is, there's different techniques with a dermal filler, using a variety of fillers from Allergan or Galderma. And then, so what we would do, so say if he had this indentation here, I would go in with filler right around this line, and just to make it visually look like there's no more loss of volume or concave line. And then sometimes patients, their lines will go all the way down, like how I was saying, into the malar fat pad. So going into almost that cheekbone area and just bringing that cheek up, and visually it will make it, everything also will come up, and you'll benefit the little nasal fold area. But then there are some patients that fillers and everything just isn't enough for them, so I'll have to send them to Dr. Park, and you can go in with yours.
Yay, now I get to
Dun,
see
dun,
you.
dun.
Okay, my beautiful wife doesn't need anything at all, but
Brownie points again.
one transition though that she brought up, I'll just show on me, is when you look at the tear trough and the lower lid is probably the most complicated area of the face and the body in general. It's very delicate. The skin above and below the eye is the thinnest, and it shows everything. What she pointed off is a tear trough. When we see a groove here, it's basically there's a hill, a valley, and a hill. It's just like geography. We can either, in her case, fill the valley up so it's straight, or if we have a fat pad forming a groove, we can take the fat pad away again to give a smooth effect. If I took bags out, we can imagine if someone has bags, that this fat's going to deflate the volume and the skin's going to be loose. So a very easy, quick surgery is the lower lid surgery. I'll pull the lid and go from underneath. So in my eye, the pink of the her lids are so tight, and so I can't even show you. But on me, I have older, looser. So I'll go in from the pink, make a tiny incision, and remove the fat. The easiest surgery I have, scarless, and it's like a 5-day recovery. One of our patients showed a nice 5-day recovery, super quick. Bags be gone, super quick and easy. Very, very, very important to complement, because on the lateral part, it treats the medial part very nicely. We still have the crow's feet. So complement that surgery here with Botox, crow's feet Botox. Then you'll get this nice periorbital rejuvenation. And then for the upper lids, it's super, super easy. If someone wanted to go really high or get the skin off of the lid, that's just skin removal here. Incision heights in the crease, super quick recovery, 6 to 7 days, sutures are out. And so the eyes I love the eyes because they heal super quick.
And the healing process with having that surgery of the lower or the upper eyes with Dr. Park is usually about 5 days, but I have seen where patients have healed up a little bit quicker than that. With under eye fillers, it's a little tricky. There are some patients, that will have some bruising, and then there's some patients that will get a little bit deeper bruising. But one thing I want to point out, and I just saw Dr. Park do this, stretching his under eye. Ladies and gentlemen,
Don't do it.
You don't do that.
I'm
It's such, that tissue and skin under the eye and on your upper lid is so sensitive that when you're pulling on it, or for ladies, you're taking off your makeup, be very careful, because you're rubbing that skin and you're stretching it out. But that is the eyes.
Let's do the money thing. That's our 4-year-old daughter does that.
So guys, if you have any other questions, please let us know. Talk to you later.